Hi everyone, I'm Dr. Catherine Zuckerman. I am a pediatrician at Oregon Health and Science University in Portland, Oregon, and this is my colleague, Dr. Ben Sanders, who is also a pediatrician at Oregon Health and Science University. And we are going to be talking about the recent study that we co-authored in JDBP entitled Early Intervention, Referral Information, Transmission, and Sources. Dr. Sanders, one thing I know about you is that you are a primary care pediatrician at heart. Can you tell me about the last time that you had a child come into your clinic and they were a little delayed on their milestones?
That happens pretty often in primary care. An 18-month toddler who really, doesn't want to speak yet, or a 6-month-old term infant who's really not showing signs of being able to sit up on their own anytime soon. So it happens frequently. It's easy to remember. Unfortunately, I can't get these kids into early intervention quite as early as I would like to. And sometimes I'm not able to after multiple attempts at referrals.
One thing that both of our research has shown us is that although we as pediatricians would like a child's path through the early intervention system to be straightforward, very often it's not. Your study really focused on the referral component of the early intervention system. Can you tell me a little bit about why referral is so important in access to early intervention care?
Sure. There are many steps along the way where things could go wrong. I think the referral step is especially important because this is the moment when critical information about the child is transmitted between two different professional environments, two different information ecosystems. And those are siloed ecosystems. So if something goes wrong there, it's really difficult sometimes to track down what happened. In addition to the fact that it's really hard to answer policy questions like how many children who are screened or had abnormal results on their screen actually receive early intervention now.
So can you tell me how exactly our study looked at these elements of EI referral information transfer?
Sure. We analyzed referral forms, and we also we surveyed state EI program leaders known as Part C coordinators. We used information from both of these to answer 3 questions. What information is sent to early intervention? Who sends this information? And how is it sent?
Great, so let's unpack some of the results of our study. Starting with your first question, what did you find about what type of information is sent to early intervention from pediatricians like us or from teachers or other community members?
Right, well, the forms showed that demographic and contact information for the child and family, along with contact information of the referral source, were big components of these referral forms, along with the third category, which would be the reason for the referral. So that's pretty straightforward. Not too much of a surprise. I did find it notable that there's quite a variation in the number of the number of fields used to collect that information. There might be 1 field or even 90 in some cases.
Great. So your second question was, who is using early intervention forms or other methods to send referrals to the program? And what did you find about who is sending referrals to early intervention?
As we expected, we found that healthcare staff send the most referrals, about 45% of incoming referrals on average. I found it notable that parents and other family members played a large role in this also. They were at about 30% of referrals on average.
And then I think the last question was how referrals are sent and received by early intervention. We know that most parents don't have access to fax machines at home like we have in our clinic. So how are early intervention referrals getting sent to early intervention, and then how are programs receiving it?
Right. Well, this may not be standard information that's collected by these programs, but we did our best to get that information, and the ones who were willing to kind of estimate how the referrals came in stated that coming in by phone was the most frequent method, averaging at about 38% of incoming referrals. We expected a bigger role for fax and maybe for email. Those were each at about 17% on average. But the second largest group was other electronic means, not email, and that averaged 23% as a group. Now, this may be the websites because a good third of states with statewide forms offered websites for ways to submit their information. But there are also some direct computer-to-computer interactions that are occurring that were reported. And we did ask also, were these direct computer-to-computer referrals coming from the EHR? And it turns out not very often. That was not very common, although Part C coordinators did seem interested in doing more of that, even using more websites and sometimes mobile devices in the future.
Seems like a really great result of our study is we have a lot more information now about the content and types of information that's sent to early intervention at the point of referral. What do you think that EI policymakers and program staff and also pediatricians like you and I can use from this study that will be useful for helping kids?
And just like any study that compares results from across the country, each state is unique and has their own set of circumstances. But I think that we can make some generalizations from the results. For example, there may be some low-hanging fruit of ways to improve the quality of information coming in and hopefully in that way improve referral completion. For example, putting up a website. Compared to arranging a computer-to-computer direct linkage, websites can be relatively cost-effective, and they can be accessed by many different types of folks in different environments. I felt like that was probably something that would many states might be interested in looking at. Another opportunity we noticed was an opportunity for increased inclusion. If more states had their forms translated into languages besides English, there might be more opportunity even for families to contribute referrals.
Well, it sounds like this study is really going to help us a lot in planning for information transfer and early intervention moving forward.
I sure hope so.
If you want to learn more about this study, go ahead and take a look in JDBP, and we thank you for your interest in our research.
Thanks a lot.